$1,400 direct payments for Social Security recipients and other Missourians went out today. Some people are still waiting for their third stimulus payment through the latest COVID relief bill. The Treasury Department says it has now issued more than 156 million payments. You can still track the status of your stimulus money using the IRS website Get My Payment tool. The Olathe Family YMCA addresses the increase of food insecurity with its mobile food pantry, and harvesters teamed up with the Y for a food distribution program. Congresswoman Sharice Davids assisted the Y with handing out fresh produce and non-perishable items. She says that it has been a challenge for many to get a good meal in this pandemic.
The pandemic has had a really devastating impact on so many people, and I know it's really threatened the lives and livelihoods of a lot of folks, and so the need is it's really great right now.
To learn more about the Y's food distribution programs, go to kansascitymca.org/food. Kansas Governor Laura Kelly thinks that it would be dumb for the state to not expand Medicaid after the latest offer from Washington. Kelly visited the Health Partnership Clinic in Olathe today. More than half the folks they treat do not have insurance. Kelly says Washington is offering Kansas another $250 million to expand the program on top of paying 90% of the first year costs.
The federal government is making it even dumber than before to not expand it. We have left billions of dollars on the table.
Kelly wants to pay for the state's share by starting medical marijuana. Lawmakers have not yet approved that. New tonight, community paramedics may get you non-emergency help fast and save taxpayer money. KMBC 9's Alan Shope explains how it works.
We have about 10 so far, called us about 100 times last year.
It's a lot different than climbing into an ambulance.
Because they just don't have any other way to get medical care.
Folks in the community that don't really need one of these, but have other issues prompting them to call for help.
Multiple times a day sometimes. And we knew taking them to the emergency room wasn't the answer.
So the question was posed, what is?
How do we find those individuals and get them that resource that they need?
Enter the city's first community medical response team. 3 paramedics that show up and provide on-site health care, home safety assessments, and
we try and get them home care or home health, and they call us a lot less.
The department says it's about going beyond the call. They say it's recognizing the needs in the community and being able to help them in a lot of different ways.
Our portable refrigerator.
The team can even transport and give COVID vaccination shots.
At the heart of everything we do in KCFD, it's about public service.
It's a way to extend health care to them in their home.
When somebody calls 911, they want assistance. And if it doesn't have a law enforcement nexus, it comes to KCFD.
Now they say they have a better way to handle those calls. In Kansas City, Alan Shope, KMBC 9 News.
Creative solution. Chief Donna Lake says the department vaccinated 28 homebound residents yesterday. She adds for each call for an ambulance, it's about $2,000 for taxpayers. This team, though, will save some of that expense.